Hello everyone, welcome back to CAPSA. Today we are going to discuss clavulanic acid, an important drug that you will almost always see used in combination rather than alone. Although clavulanic acid itself does not act as a strong antibiotic, it plays a very critical supportive role in antimicrobial therapy. Clavulanic acid is a beta-lactamase inhibitor that is obtained from Streptomyces clavuligerus. Now, beta-lactamase is an enzyme produced by many bacteria. Its function is to break the beta-lactam ring of antibiotics like penicillins and render them inactive. This is one of the major mechanisms of bacterial resistance. Clavulanic acid by itself has no significant antibacterial activity, but when it is combined with beta-lactam antibiotics, most commonly amoxicillin, forming what we call Co-Amoxiclav, it protects the antibiotic from destruction. In this way, it restores the activity of amoxicillin against beta-lactamase producing organisms. If we look at the structure and mechanism, clavulanic acid contains beta-lactam ring similar to penicillins, but it has very minimal intrinsic antibacterial action. Its importance lies in the fact that it acts as a suicide inhibitor. This means it binds irreversibly to the beta-lactamase enzyme. Once the enzyme binds clavulanic acid, it gets permanently inactivated and can no longer destroy the antibiotic. Clavulanic acid is effective against class 2 to class 5 beta lactamase producing organisms, like especially the plasmid mediated enzymes commonly seen in organisms like Staphylococcus aureus, Haemophilus influenzae, Neisseria gonorrhoeae, E. coli, Proteus, Klebsiella, Salmonella, and Shigella. However, it is important to remember that clavulanic acid is not effective against class 1 chromosomal beta-lactamases, such as those produced by Pseudomonas and Enterobacter. And it is also ineffective against MRSA or methicillin resistant Staphylococcus aureus. Moving on to pharmacokinetics, clavulanic acid is well absorbed orally with about 60% bioavailability. It distributes widely into the body tissues. It is metabolized mainly by hydrolysis and decarboxylation and is excreted through the kidneys by glomerular filtration process. One important point here is that its excretion is not affected by probenecid, unlike many penicillins. The half-life is about 1 hour. Its pharmacokinetic profile closely matches that of amoxicillin, which makes co-administration very convenient. Clinically, clavulanic acid is always used in combination with amoxicillin. This combination is commonly prescribed for skin and soft tissue infections, intra-abdominal and gynecological infections, respiratory tract infections such as sinusitis, otitis media, and bronchitis, as well as urinary and biliary tract infections. It is also useful in hospital acquired infections caused by beta-lactamase producing organisms. In case of penicillinase producing Neisseria gonorrhoeae, a single dose regimen combining amoxicillin, clavulanate, and probenecid has been used. Now let us look at the dosage forms. So Co-Amoxiclav is available as tablets, oral suspensions, intravenous preparations. The dosing can be twice or three times daily for oral formulations, while intravenous doses are usually given every 6 to 8 hours. Now let us briefly look at the adverse effects. Gastrointestinal side effects such as diarrhea, nausea, and vomiting are common with clavulanate containing combinations than with amoxicillin alone. This is because clavulanate tends to irritate the gut. Other effects include candidiasis, skin rashes, and rarely cholestatic jaundice and hepatotoxicity, especially in elderly patients. Hypersensitivity reactions can occur due to cross reactivity with penicillins, and higher doses of clavulanate are associated with increased gastrointestinal intolerance. In terms of drug interactions, probenecid does not significantly affect clavulanate levels. Allopurinol increases the risk of rashes. Oral contraceptive efficacy may be reduced due to alteration of gut flora, and anticoagulant effects may be enhanced, leading to an increased INR or international normalized ratio, which is a standardized measure of how long blood takes to clot and is commonly used to monitor the effects of anticoagulant drugs like warfarin. Finally, a few important precautions and contraindications. Clavulanic acid should be avoided in patients with penicillin allergy and used cautiously in those with liver dysfunction. With regular monitoring of liver function tests, dose adjustment is required in severe renal impairment. It is particularly valuable for infections caused by beta-lactamase producing organisms and for mixed infections such as animal bites. However, it should not be used unnecessarily, as an inappropriate use contributes to antimicrobial resistance. Always remember, it is ineffective against MRSA and ampicillin C beta-lactamase producers. So to conclude, clavulanic acid itself is not powerful antibiotic, but when combined with amoxicillin, it becomes an essential tool for overcoming beta-lactamase mediated resistance and expanding antimicrobial coverage. Thank you for listening, and I will see you in the next lecture.